Before entering my patient's room, I'll first gather my supplies. My patient and I are already wearing a mask. I have my Foley kit, stat lock, sage G swab, a syringe, a basin with soap and water, clean gloves, sterile gloves, and the clean chuck that I've already placed under my patient. I'll enter my room now, knock knock. Upon entering my room, I'll perform hand hygiene, 20 seconds. Good afternoon, Mrs. Jones. My name is John Michael Azada, and I'll be your student nurse today. Now, Mrs. Jones, could I have you state your full name and date of birth for me? Jane Jones, March 10, 1994. Very good. Now, Mrs. Jones, do you have any allergies, specifically to iodine or latex? No? All right. Are you experiencing any pain at the moment? No pain? Very good. Now, Mrs. Jones, today, as per doctor order, we're going to be inserting a Foley catheter in you. This is going to be going into your urethra and into your bladder. This will allow you to release the urine that you've been retaining since you've been having some trouble passing urine the past few days. Okay, now during the procedure itself, you may feel a bit of discomfort, but we're going to try to make this as easy and painless as possible. Now, do you have any questions or concerns about today's procedure? No? And have you had this procedure done before? Yes? Okay. I'm going to move my supplies off the table. I'll perform hand hygiene, 20 seconds, and we will prepare our work area. All right, I'm going to start by wiping down the tabletop for a full 30 seconds. All right, Mrs. Jones, before we insert your Foley, it's really important that we clean your perineal area or your genital area. And we're going to do this first with soap and water, and then we'll sterilize it with iodine. Then we'll insert your Foley, collect the urine specimen to send to the lab, and then we'll stabilize the catheter onto your outer thigh. Does that sound good? Yeah? All right, very good. All right, I'm going to allow it to dry for a full 2 minutes. While I let that dry, I'll close the door, close the curtain for some privacy. I'll place my patient in a supine position or lay her flat. And now the table is dry. I'll go ahead and doff my gloves, perform hand hygiene, and place my supplies on the table. Okay, I'll perform hand hygiene, don a pair of gloves. And now, Mrs. Jones, it's about that time to clean your perineal area. Is it okay if I place your blanket down? Okay, and just for everyone's information, I do have a female nursing assistant present here with me, since I am a male nurse, so she'll be here to supervise us, okay? So I'll go ahead and place your blanket down, and I'll lift up your gown. Okay, and I did place a blanket on your torso to keep you warm. And let's go ahead. And is it okay if I externally rotate your legs? Yes? All right, thank you. Thank you. Is that comfortable for you? Yeah? All right. Place that right here. And we'll grab the wet cloth, the soap and water. One swipe front to back on the outer. One swipe outer. One swipe inner, all front to back. Go ahead and pat it dry, front to back, pat, 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 pat. And dispose of that. Okay. Off my gloves, perform hand hygiene, don another pair of gloves. You doing okay, Mrs. Jones? Yeah? All right, very good. So we'll go ahead and prepare our sterile field now. Going to remove it. Dispose of that. Going to make sure to open it very carefully, only touching the corners or within a 1-inch border. Making sure to not hover over the field. Grab the sterile gloves, save that here for later. I'll drop in our supplies, starting with the syringe. Dispose of that. I'll drop in our stat lock. Dispose of that. And finally the CHG swab. Dispose of that. Okay, so we're all good with that now. Dispose of my gloves, perform hand hygiene. Go ahead and put on our sterile gloves now. Again, making sure to only touch within a 1-inch border of the wrapper. Okay, I'm gonna go ahead and fix my fingers now that I have them both on. Okay. All right, now that I have them on, I can fix my fingers and fix the cuffs on both sides, making sure to not touch my arm or drop my hands below my waist. I'll go ahead and discard that. And I will grab our sterile drape here, place it on the patient. Shiny side facing down. Okay. Go ahead and grab my items here and place them down. Okay, dispose of that. All right. Go ahead and grab our sterile water, touch it. We'll remove the sheath carefully. Dispose of that. Place that down. Grab our lubricant. Dispose of that. Place the catheter in the lubricant. Place it down. Alright, and then we'll rip the wrapper open for the swabs. And place it in between the patient's legs. Okay. Alright, Mrs. Jones, we're going to start cleaning your perineal area now. So I'm going to go ahead and spread open the labia as much as I can, like so. And one swipe outer. One swipe outer. And one swipe inner. All front to back. All right, Mrs. Jones, are you ready? All right, Mrs. Jones, if I could have you give me a deep breath, and then I'm going to count to, hold your breath. I'm going to count to 3. 1, 2, and at 3, you're going to exhale, okay? 1, 2, 3. All right, thank you, Mrs. Jones. I do see urine coming out, so I'm going to advance 1 more inch. I'm going to let go of the labia now, and the sterile procedure is over, but I'm not going to let go of the catheter with my dominant hand. I'm going to fill the balloon with 10 cc's of sterile water. And that. And I'm gonna ever so just gently pull on the catheter until I meet resistance. Okay. All right, Mr. Jones, we're pretty much done. I'm gonna go ahead and grab our specimen bottle here. I'll place it over here. And I'm gonna grab a CHG swab, pinch it from the top, and scrub the hub for 15 seconds so we can collect our urine sample. Okay, gonna allow that to dry. Okay, it's dry now. I'll grab our syringe here to grab our specimen. I'm going to make sure that urine is coming out. Since I do see urine flowing, I'm not going to, there's no need to kink the tubing below the port. Grab our specimen. Gently place it inside. Okay. All right, and I'm going to label this with the date and time, the patient's name, the MRN, and we'll send it off to the lab. All right, Mrs. Jones, we're pretty much done, almost. Let me go ahead and stabilize your catheter now. I'll wipe the outer thigh with the skin protectant. I will grab your stat lock and place it on here. Bring these out. I'll place it on your thigh. Sorry about that, Mr. Jones. Just a little bit of pressure here so I can make sure it sticks. Okay. And I will also clip it on the side of the bed, like so. And finally, I'll hang it on the side of the bed below the level of the bladder to allow the urine to drain. And clip it right here. Okay, let's go ahead and get rid of this right here. I'm gonna doff my gloves. Actually get rid of this as well. I'll perform hand hygiene. Don another pair of gloves. You doing okay, Mrs. Jones? Very good. Yeah, no pain? No pain? Very good, very good. Okay. Okay, so if I can go ahead and put your legs back into position, is that okay? Yeah? All right. I'm gonna place your gown back down. Gonna put your blanket up. Okay. All right. I'm gonna put your bed in its lowest position. I'm going to put both your side rails up. I have your call bell right next to you. If you need anything, please let me know. I'm gonna doff my gloves, perform hand hygiene. We'll get your specimen sent off to the lab, and I'll leave the room now. And upon leaving the room, I'm gonna record the date and time, the patient tolerance of the procedure, the size of the catheter used, and also the tolerance of the procedure. She didn't experience any pain, and the description and amount of the urine. There was no cloudiness, no sediment, and yes, thank you.